to join or anything like that. And so with that, we'll go ahead and get started. My name is Megan Ockett. I am the Associate Director of Programs with Count the Kicks. I am so excited to be here today and presenting to you all. We have done a presentation in North Dakota before, and this is my second time doing a webinar for you all. So if you haven't heard about this awesome program, I'm excited to hear. I'm happy to answer any questions that you have or anything like that. And I just wanted to do a quick shout out to the North Dakota Department of Public Health. It's because of them and our because of them and our partnership with them that we are able to provide you with trainings like this. We are able to provide you with free Count the Kicks materials, which I'll talk about in a little bit, and that you can order completely free, sent directly to you to help educate your expectant parents about the importance of tracking fetal movement. And so thank you to North Dakota Department of Public Health. And so like I said, my name is Megan Ockett. I'm the Associate Director of Programs with Count the Kicks. My contact information is on the screen there. You can contact me via email or by my phone. I love hearing from you. I love hearing what's going on in the community, how you're utilizing Count the Kicks, if you need additional things, what thoughts you have on the program and things like that. So feel free to contact me with any questions you have, any needs. I'd be happy to hear from you. And before we kind of dive in, I have two poll questions I'm going to try out with you guys. I'm going to launch two of them here. One is, I want to know, how did you hear about this webinar? And the second one is, have you heard about Count the Kicks before? So let's see if I do this right. Okay, so there should be two pop-ups on your screen, or one, but it's two questions. I see y'all figured it out. We did a mailing and I did email. So I just like to know how people heard about us, what maybe works better than the others, that type of thing. So awesome. Looks like a lot of you got an email about it. Some of you have heard about Count the Kicks. Some of you have not. Great. Okay, that's very helpful. I'm excited that some of you have heard about Count the Kicks. And I hope that this is a refresher for you and you learn something new. And those of you who have not heard about Count the Kicks, I'm so happy you're here today to learn about this campaign and be able to implement it into your organization. All right. So before we get too into the weeds of everything, I wanted to highlight Mylin. Mylin is a wonderful woman who reached out to us several years ago. We originally worked with her as the North Dakota State Health Officer. She's no longer there at the department, but she is brave enough to share her beautiful story of how she came to be at Count the Kicks. They lost her daughter, Mayna, who was born still. And this is a quote from her bio, where it says, "Count the Kicks educates and inspires expectant mothers to track their baby's fetal movement during the third trimester. Through a public health awareness campaign, supportive tools, and technology, we have the opportunity to save babies and families." And so we're so thankful for Mylin for helping bring us to North Dakota and for being brave to share her story about her beautiful daughter, Mayna. And you can read more about her on our website. And before I get started, I'd like to share this video of Good Morning America. This is when, in 2017, there was a video that aired on Good Morning America highlighting a baby safe story from Count the Kicks. Baby Ruby was saved in 2017 when her mom noticed reduced fetal movement and spoke up and went into her doctor, and doctors realized, you know, baby wasn't moving like baby should be moving, and decided baby needed to come out. And so I really like sharing this video. I think it gives you a really good overview of just how important this campaign is, how easy it is to use, and the fact that after this aired, we had a 3,700,000 increase in app downloads, because we know that storytelling is really what helps us share this information and gets it out in the community. So you can share this video. It's on our website. It's on our YouTube channel with your expectant parents. I do have some issues with video, so I'll be sure to add these into the email that will go out as well to you all.
We're going to turn now to that GMA Parenting Alert about a free app a mother says helps save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble. For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes, so when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby. Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Great, so hopefully you heard that okay. And so Count the Kicks is a highly effective evidence-based stillbirth prevention campaign. We developed an early warning system for moms. We're saving 1 in 3 at-risk babies in Iowa. We did not invent kick counting. We just invented the tools and resources to help providers have this conversation with their expectant parents, and for expectant parents to understand the importance of tracking fetal movement and understanding what's normal for their baby in the 3rd trimester. And then, of course, we're ready to go and low cost. And as you know, thanks in partnership to North Dakota of Department of Public Health, we are able to bring this to you all for free. Before we get into too much further of the actual campaign, I think it's really important that we define stillbirth, miscarriage, and infant mortality, just to make sure that we're all on the same page. So a stillbirth is a loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, 23,500 babies are born still every year in the United States. A miscarriage is usually defined as a loss of a baby before the 20th week of pregnancy. And then there's infant mortality. And infant mortality and stillbirth are the ones that probably get confused the most. Infant mortality is death of an infant before his or her first birthday. So that's after baby's born. On average, around 22,000 infants die every year in the United States. So you can see stillbirth is slightly higher than infant mortality. It is just as prevalent as infant mortality, yet nobody's talking about it. We lose close to 24,000 babies a year to stillbirth, and we need to start changing the conversation. We need to be having these difficult conversations and these conversations about stillbirth prevention so we can lower that bar and make it just as easy to talk about as the Back to Sleep campaign. And that's my goal here today, is to make sure you become comfortable in talking about Count the Kicks and to talk about tracking fetal movement so that you feel comfortable sharing this with your parents so that you can help lower that statistic. And so maybe you want to know some of the causes of stillbirth. We have a lot of research studies on our website if you're interested in research and learning more of things like that. So this one research study states that some of these are causes and contributors to stillbirth, and these are listed below in order from most common to least common. So things like pregnancy and labor complications, problems with the pregnancy likely causes almost 1 in 3 stillbirths. Things like preterm labor, pregnancy with twins or triplets, and then problems with the placenta That's almost 1 in 4 stillbirths were likely caused with that. One example of a placental problem that causes stillbirth is insufficient blood flow to the placenta, and other placental issues, then birth defects. In more than 1 of every 10 stillbirths, the fetus had a genetic or structural birth defect. Infection: in more than 1 of every 10 stillbirths, the death was likely caused by an infection of the fetus or the placenta, or by a serious infection of the mother. And then problems with the umbilical cord, like you heard Ruby's story, that's 1 in 10 stillbirths. Cord can get knotted or squeezed, cutting out the oxygen. So these are just some of the ways that are causes of stillbirth that I wanted you to be aware of. And with that, we're going to go into why this was created. Why was Healthy Birthday and Count the Kicks created? So in the early 2000s, 5 Iowa moms endured the heartache of losing a daughter to stillbirth or infant death. After they didn't know each other at the time of their child's death, and after being connected through friends and pastors, they formed a really strong bond. So you can see there on the screen, that's Jan, Janet, Kate, Carrie, and Tiffin. And so during many connected conversations over coffee, the women decided to channel their grief into stillbirth prevention efforts to keep other families from facing the pain of losing a baby. So one of the very first things they did was in 2004, they worked with the Iowa legislature and Senator Tom Harkin to create Iowa's Stillbirth Registry, the most comprehensive stillbirth data collection program in the country. Working with U.S. Senator Tom Harkin at the time and his support, they secured some CDC funding for the project. And so they were asked to speak about this project at a national stillbirth conference. And it was there at this conference that they heard about a public health research study that had took place in Norway. And this study demonstrated a 30% reduction in stillbirth by teaching pregnant women how to monitor fetal movement during the 3rd trimester of pregnancy by doing kick counts on a daily basis. Several other scientific studies, not just the one in Norway, indicate kick counting, a daily record of babies' movements, so things like kicks, rolls, punches, jabs, anything but hiccups. Hiccups are involuntary, so those do not count. During the 3rd trimester is an easy, free, and reliable way to monitor a baby's well-being in addition to regular prenatal visits. And so the women came back to Iowa after learning that and said, this is our next project. They decided that even if it saved just 1 baby, it would be worthwhile. And so based off evidence and scientific research, the public awareness campaign Count the Kicks was born in 2008. The next year, they created Healthy Birthday, the 501c3 nonprofit, as a way to help fund efforts to spread Count the Kicks message. Before that, they got some small funds. They worked with a local marketing company to create the materials and to send it out to as many birthing centers, OBs, midwives as they could from one of their basements. And when they were creating these pieces, they really wanted to create something that was bright and colorful and empowering. And you'll see, if you haven't seen the material before, you'll see it later today on the presentation, but it is very bright and colorful because we all know that stillbirth is a very dark, sad subject that nobody wants to talk about. And so what the women wanted to do was to create something that was empowering and mom-centered so that they would feel comfortable talking about it. And so after they created the nonprofit, they created a web-based Count the Kicks app in 2013, which quickly turned into a mobile app a couple of years later. And in the first 5 years of Count the Kicks, the Iowa stillbirth rate decreased nearly 29%. And in the first decade, we have from 2008 to 2018, there has been a 32% reduction in the stillbirth rate in Iowa. And so what we're doing is we're continuing to connect with other state partners and bring Count the Kicks to their state so they can see the exact same decrease in stillbirth, just like we've seen in Iowa. And so a little bit more about data. This is national data from CDC. 1 in 167 pregnancies ends in stillbirth, and the racial disparities are huge. Black women, it's 1 in 94. Indigenous moms, it's 1 in 138. Hispanic moms, it's 1 in 191. And then white women, it's 1 in 204. Families are 10 times more likely to lose a baby to stillbirth than to SIDS, 10 times. So now that you know more about the national data, I just wanted to quickly share about the Iowa data. And so as you heard earlier, I mentioned that we are at, we had a 32% reduction in the decade since our existence. So in 2018, there were 3.9 fetal deaths per 1,000 live births. That's the lowest Iowa stillbirth rate on record and one of the lowest in the United States. But we're still losing babies. We're still losing an average of 174 babies to stillbirth every year. And again, those racial disparities are large. So while our rates are far better than the national average, we still lose one baby for every 109 pregnant Black women, while for white women, it's 1 for 250. And so when we look at the stillbirth data for North Dakota, this is what I have. You can see the yellow line is the average stillbirth rate across the United States. And then the red bar is your North Dakota rate. And so I only have data through 2018, but 1 in 177 pregnancies ends in stillbirth every year in North Dakota. So if you take that and couple it with our 32% reduction in how we implement the campaign, we have the potential to save 19 babies a year from preventable stillbirth. And that's what we hope to do by talking to you today. So you might be thinking, why are there such large disparities for stillbirth? There's a lot of research out there. I don't think this will be surprising to any of you, but a couple key points I wanted to mention that I think are important to bring context to. So that epigenetics, those physiological variations that are caused by external or environmental factors, literally generational changes in the DNA sequence. And then some of those environmental factors like systemic racism and toxic stress, years and years and years, generations and of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society has led to real and pervasive health issues for Black women. Predisposition to certain conditions like gestational diabetes, preeclampsia, high blood pressure, all linked to maternal stress. Experts say that Black women are less likely than other races to receive early treatment for these conditions. This is another reason why we really want to encourage women who do not have a primary care provider or an OB or midwife to make sure that they are getting the prenatal care as early as possible. And then access to healthcare, socioeconomic barriers. But research shows education is not a determining factor. In fact, a college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So now that we know there are such large gaps among racial disparities in stillbirth, we have truly made it a priority to focus on this issue. We have done a variety of different things to shine a light on this issue and hopefully decrease the number of stillbirths among these individuals. Some of those things that we've worked on are on your screen. So we are always looking for funding opportunities to focus on racial disparities. We are working on a grant right now in Iowa where we're piloting a project to primarily Black beauty salons and primarily Black churches to educate the hairstylists and the pastors and leaders within the church about Count the Kicks so that they can share it with their community. We also have held several focus groups with African-American women to help plan and prioritize our outreach efforts. And one of the key takeaways that we learned in one of our focus groups was the women were shocked that they had no idea they were 2 times more likely to experience a stillbirth. And they were angry. They were wondering why nobody's talking about this. Why is nobody shouting this from the rooftops that they're at an increased risk? And so we have made sure that the language we use is just very upfront and we don't sugarcoat it and things like that. And so, like I said, we've done our faith-based toolkit, outreach within the African-American community. We also have our app available. Again, it's for free and it's in more than 10 languages. And we're always making sure that we have culturally appropriate material and languages. If you have additional ideas or things that you'd like to see brought to North Dakota, I would love to hear about them so we can make sure we share that with our state partner because we want to do what works for you and you know the community best. And again, here's some more North Dakota stillbirth numbers, the CDC data, 5.57 fetal deaths per 1,000. We look at averages of fetal death rate as well as yearly. So the 5-year rate is 5.48. You can see the comparison there over the 2003 to 2007 and then 2008 to 2012. And there were 60 stillbirths in your state in 2018. Of those, 13% were American Indian women, and then white women accounted for 72% of stillbirths and other races represented 15%. So you can see the indigenous population is quite high in North Dakota. So that would be something that if you work specifically with that demographic and population, how else could we help reach that and make sure that we're educating them on the importance of tracking fetal movement? And so, of course, we feel this is a fantastic campaign, but it truly isn't just us. We have supporters from all over. We have 11 state partners, national networks that support us. But here is a great video that I wanted to share from one of our biggest supporters, somebody from the very beginning, Kim Piper. She works for the Iowa Department of Public Health. She is the executive officer for the Center of Congenital and Inherited Disorders. And she also used to be a labor and delivery nurse. So she has firsthand experience on what a stillbirth is like on the medical side as the health team, and then now trying to prevent those. So let's hear from her.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements, and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So one of the things that Kim Piper has said is this very long quote, but I bolded what I really wanted to point out, that research shows that babies can be saved if expectant parents are educated about tracking their baby's movements and immediately reporting any changes in the baby's movement pattern to their healthcare provider. And that is what research does tell us. This is the research study that started it all out of Norway. Dr. Ruth Fretz also said a very similar thing. Tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health, and that babies can be saved. Because what we're really trying to do is let expectant parents know what is normal for their baby and that pregnancy, because every baby and every pregnancy is different. So we're going to talk about that in a little bit. But if you're really into research and you like the evidence, I just wanted to really stress that this is a research and evidence-based campaign. We have tons of research articles on our website. If this is something that you like to connect with, these are just a few links here. And I will connect when I send an email, I'll be sure to send a link to our research page so you can view all the different studies that have been done around this. And so let's get into it. So implementation of Count the Kicks. So truly what it is. So Count the Kicks, as you know, is a stillbirth prevention public health campaign. Like I said, it's evidence-based and it's mom-focused. And the most important thing is it educates women on the importance of tracking fetal movement and understanding what's normal for their baby. We have the mobile app, and then we also have paper charts. So for individuals where, you know, Wi-Fi broadband's an issue, they don't have a smartphone, or they just like that pen and paper, we have those available on our website for free to download. So if you work with a population like that, or would like to have some on hand, feel free to go to our website and download them and just print a bunch, and then you'll have them on hand. And then what I love about the campaign is it truly empowers moms to speak up to providers if there is a concern, and that's what it teaches them. It empowers them. It really puts it in their hands to notice when something's off and to say, hey, look at my chart, this isn't right. And so when we talk about the app, if you have a smartphone, I highly suggest right now you take it out and you go into your app store, whether it's the iTunes store, the Apple store, or the Google Play store. Just search Count the Kicks and you will see a little yellow icon pop up, and that is our app. And the reason I want you to do this is because you will be talking about this with your moms, and it will be so important for you to pull out your phone when you're having these conversations and say, hey, look, I downloaded it. I've played around with it. This is how easy it is to use. I just want you to become familiar with it so you are comfortable talking about it with your moms and expectant parents. And so again, it's completely free. It's available in 12 languages. You can see those on the screen. If you don't see a language there and you work with a population that might need it in a different language, let us know. That is something that we could talk to the Department of Public Health about to say, there's a need for this. Let's see how we can get that done. That's exactly what we did with Haitian Creole. We recently launched in Florida, and they came to us and said, you know, we have a very large Haitian Creole population here. We need the materials and the app in Haitian Creole. And so we worked with them to ensure we translated it correctly, and now it is available in Haitian Creole. Some things that you can do with the app: you can share kick session results on social media or send via email, so moms can send directly to their provider. There's push notifications, so reminders to remind mom to always count at least daily. We're very busy, especially in this time of COVID, where I feel like we're busier than normal, having tons of Zooms like this, and you know, our kids might be doing online school and all of that. So having that reminder is really helpful. And then something new we implemented this last year was this post-pregnancy survey, where once mom has passed her due date, there is a notification that comes and just asks if she's had her baby. And then what it does is it goes through a couple questions just so we can get a better idea of the birth outcome. It asks questions, things like, did the app make you feel less anxious or more anxious? Did it help you bond with baby? Did you notice reduced fetal movement and speak up? If so, what was the next step? So we're just trying to get a better understanding of moms and how they view the app. We are also doing a research study on the app, and we have surveyed all of our app users over the past couple years. And we have a manuscript out right now. So as soon as that gets published online, we will be sure to share that with all of our partners, because I think that's going to be really enlightening to really show the correlation between a health app and something like stillbirth prevention and saving lives. And so again, I hope you have, during my spiel there, I hope you have downloaded the app, that you have, all you do is you go to account and you set up a pregnancy profile, and then you can start your kick session. You do not have to be pregnant to use this as you're practicing it. It's totally fine to use, so you can become familiar with it. And like I said, I highly recommend that. I use it all the time, and I'm not expecting, just so I can stay up on it and make sure that it's working as it should be working. So you can count for singles or twins. And what's really important about this, again, is moms can tell what's normal for their baby. When you're talking to your expectant parents, be sure to share that with the patient to contact their provider if they notice a change. Make sure mom and husband and significant other and grandma, who's ever with them in the house and living with them, knows who to contact if there's a change in movement. So when we talk about a change, what does that mean? And so the apps are showing the average time it takes to get to 10 kicks right away. And then users will start to see a pattern or trend. And so if we go to this slide, you'll see the graph there. So that's what the graph looks like on the app. So after about 5 sessions, it will always show 5 sessions on there. You can view all the sessions, but 5 sessions will show you, because what it's doing is the app is showing mom, expectant user, or expectant parent, how long it's taking baby to get to 10 movements. So you can see on the graph here, it's pretty in line. It looks like baby's taking around 15, 16 minutes for every session on every day. And so what would happen then if mom is tracking and all of a sudden it's taking 45 minutes, 50 minutes, what's going to happen is you're going to see that line shoot up on the graph. And so that's going to be an indication for mom that that's not her baby's normal movement pattern at that time of day, like she normally counts. And so she should contact her provider. And so that's what I would really stress to your parents, is that, like I said, every pregnancy and every baby is different. So it might be normal for my baby to get to 10 movements in 15 minutes, but it might take my friend Sarah's baby to get to 10 movements in 30 minutes. She knows 30 minutes is her normal, and I know 15 minutes is my normal. So that way, if for some reason I'm counting someday and all of a sudden it's taking 30, 40 minutes, I'm going to call my provider and just ask them what to do next, because we don't pretend to be medical doctors. What we do is we empower moms to understand what's normal with their baby, to bond with baby, to understand their body, and then to speak up if they notice a change. And then the doctor needs to take it from there, and we'll do all the proper protocols. And so I recently added this slide into the presentation. It's pretty long, so I won't go all of it. There's no volume, but basically what it is it's me on my phone going through how to use the app. And so I started adding this because I thought it just gave a better visual of truly what it is like. So you can see I hit the little footprint when I was starting, and the timer started right away. And so as I'm getting those movements, I click, and then I also do, I go back and, you can go back, and this is the carousel, we call it, so moms know what to do and how to use it and things like that. And so if you wait 1 minute, it's going to go back to the screen, and there it is. So it's just the time has stayed and everything like that. So I'm going to wait to get to 10 movements at least so you can see that. So then it says continue counting. So this is a new feature we did because we had users give us feedback that are like, what if I go off, or my toddler comes over and it's like, I have to pee. And so what they did is we added this feature where they can continue counting so they can pick up where they left off. So you can see I'm just finishing the session. My baby moves very fast and was done in 1 minute. So that was my first session. And so once again, I'm going to just show you stuff. I'm going to count again. I'm going a little faster. This is me sending the information to somebody if I wanted. And then here's all the options. You have pregnancy profiles, share your story, contact information, sync data, you delete account, sign out, change password. You can change languages there. Add reminders, which we really recommend doing because, like I said, we're all very, very busy individuals. That's the session history. You can delete it if you, for some reason, messed up. This baby's all over the place, so I could probably call my provider. And then here I am working to count for two babies. And so every time the baby is highlighted in this teal, that's the baby I'm counting for. So you can see it just switched over to baby number 2. It turned teal. And so I'm going to flip back here to baby number 1, and it's teal again. So that's how you count for twins. And again, you can finish the session, you can get the history and send it. So that's a pretty quick overview, but I think when you start using it and become more comfortable with it, that's when you'll be able to share it with your parents and feel really good about it. So let's get into, we have about 20 minutes left, and I really want to talk about the enhancement of care and how you can incorporate this, whether you're a home visitor, whether you're a nurse or a doula, whether you're just a community member, you can do this. You don't have to be a doctor or medical provider to talk about this with your expectant parents. So some things that we think about when people are talking about this and what you might worry about. And some of this might be you might worry about it, or your moms might be thinking this. So you don't want to scare moms. And I think it's important to remember that pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about, just like that focus group that I told you about in the beginning, where the women were just so upset and shocked that they had no idea that they were at such an increased risk. So, you know, we're not delicate flowers. Tell us what we need to know. Stillbirth just happens. There's nothing we can do. There actually can be warning signs. Reduced fetal movement is one of the first signs that baby's in distress. So if mom knows what to look for, she can speak up sooner rather than later. Her baby's always active. It's not a concern. When I first started doing these presentations, I always used to say, this is probably something you hear a lot more from your parents. You know, your moms would say something like, oh, I don't need to worry about it. Baby's always moving, which is true. I think you do get that a lot. But lately, I have also unfortunately heard some stories of losses where the provider has said, you don't need to count movement. Your baby's always active. It's fine. And so I really want to highlight this because it's unfortunate, and we need to start changing that narrative. So again, babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. So if mom knows Yeah, my baby is active. My baby gets 10 movements in 5 minutes every single day. They're moving all the time. So make sure they know what time of day they're counting and that is happening 5 minutes. So they know the next day if they're counting and baby's so fast and quick and moving all the time, yet baby seems slower or the movement seems softer. And it's now taking 20 minutes versus the 5 or less minutes. Those are changes. And so with your active babies, that's just something to be aware of. It's also a way they can bond with baby. They can include significant others and siblings, lay down, put your feet up, have, big brother or sister come over and put their hands on the belly and things like that. So that's what I wanted to say about that. And then she's almost at her due date. This is kind of an old wives' tale. You might hear this from grandparents. I remember my grandma always being like, oh, babies move less their due date. That's a myth too that we'll talk about. But the risk of stillbirth actually increases as mom approaches or exceeds her due date. So some additional misconceptions: babies move less the closer to their due date. They don't move less, they move differently. Moms might feel less sharp kicking and more rolling. However, if they're monitoring the baby's movement at the same time each day, it should still take the same amount of time to feel those 10 movements. There's the active one again. Tracking your baby's movement every day takes the guesswork out of knowing. I remember doing that. So I have 3 children. I have a 7, 5, and 2-year-old. And I remember with my 7-year-old being like, always, we didn't have the app then, and being like, did it take 15 minutes or was it 30 minutes? I could never remember. I wasn't good about writing it down or anything like that. So I would have loved the app back in 2013. Here's a big one, especially now in a time of COVID where we're having more and more telehealth appointments. And I don't know what you're seeing in North Dakota when it comes to appointments. If you're meeting a lot virtually, which is fine, and you can still share all this information, but I don't know what providers are doing with their patients. I have heard about some providers handing out Doppler devices and blood pressure cuffs. And so I would just, make sure that people are properly trained because, I can hear a baby's heartbeat on a Doppler device. So again, a change of the baby's heartbeat is one of the last things to occur when a baby is in distress, where decreased movement is an early sign. So we really want to make sure mom is tracking her movements. Here's that generational one. Baby's just getting ready for birth and running out of room. Baby should continue to move up to and during birth. And here's a newer one that I think always catches people by surprise, the 10 and 2. This is actually a common misconception and outdated information. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern. That's why I keep saying and going back to what's normal for their baby. Again, if you're really into research, I have a whole research study on this on our website. But basically what it says is when you put a time limit on it, moms get so stuck on that time limit. So those moms who they're counting and they usually get it in 15 minutes, their 10 movements, but one day they get it in 1 hour and 59 seconds. And they think that's great and fine because they got it within that 2-hour time frame. So what we want to do is we want to start changing that thinking to think more what's normal for their baby. So I can't stress that enough. So when should you start talking about this? 26 weeks of high risk, 28 weeks otherwise, which is the 3rd trimester. If any of you do childbirth classes or anything like that, that is a great time to introduce this. We have some childbirth lesson plans that I think are on here too, but they're also on our website. So when you talk about it with your moms, if there's any way to include it in any paperwork or documentation. So if you have family care plans or intakes or care plans or anything like that, to track if mom's pregnant or becomes pregnant. And then in the 3rd trimester, you want to start asking, do you know about the importance of tracking your baby's movement? Let's talk about how to track your baby's movements and make sure you share how movements are jabs, rolls, pushes, anything but those hiccups, again, because those are involuntary. And then of course, share the app. Another helpful tip is if they're going in for their glucose test, make sure mom knows about the app and say, download it there, let's talk about it. Or if you're a provider, start integrating that into your glucose screening, that you're gonna have mom take the drink, she's gonna go in the waiting room, and then she's going to download the app and come in during her 15-minute appointment and talk to you about the app. So again, things to keep in mind. Stress the importance of knowing their baby's normal movement pattern and speaking up if there's a change. make sure mom knows what number to call if she has a concern. Write it down, put it on the fridge, whatever you need so mom knows who to contact. Send a brochure home. Again, this is all free material. So what I'm really hoping is that you go to our website either during this or after and order the material, because you should take advantage of that. This is free for you, and it's so easy to implement and to share. Again, share with mom that research shows evening is usually the best time to count babies' movements, but I understand third shifts and routines and schedules, and so just make sure mom knows to pick roughly around the same time every day. And then if you're not her provider, make sure that she's feeling empowered and encouraged to speak up to her provider, especially if her provider is not talking about it. Her provider should be saying things like, tell me about your baby's movements. How is tracking your baby's movements going, using those open-ended questions. And so talk to your mom, expectant parent, to say, hey, has your provider talked to you about this yet? You know, here's what it is. This is what you should do. Bring it up at your next appointment. And then it kind of flips the table on them for the provider to say, oh yeah, like, let's talk about that. And so it's all about that empowerment. So here's some sample lesson plans if you are a childbirth educator. I didn't see anybody in the chat say that. So again, even if you're not, this is a really great, easy tool. It's kind of like a mini curriculum. You can see it's just one page, front and back. But this would be great to print and keep in your folder to share with staff. It really just helps you understand what all you could share with your expectant parents. This is a really quick video I want to share. This is a really neat way to show to your expectant parents about why they should count kicks. So I'm going to show this quick.
Count the Kicks is a great way to monitor your baby's well-being, which is why many doctors recommend making this part of your daily routine at 28 weeks or 26 weeks if you're high risk. It's easy to do using our free Count the Kicks app. Just pick a time when your baby is active, preferably the same time every day. Sit with your feet up or lie on your side. Count each movement as one kick by tapping the footprint on the screen, and the app will show you how long it takes to reach 10. You'll soon get to know what's normal for your baby. If you notice a change in the strength of your baby's movements or how long it takes to get to 10, contact your healthcare provider right away. The Count the Kicks app is free and available in 12 languages. Our app makes it easy to track and save each day's kick counting session. You can even email or text your sessions to your provider or family. Don't delay. Visit the App Store to download Count the Kicks today. And remember, every kick counts.
So that's a really great video that you can share with your moms. Again, we have all of these great resources on our website and our YouTube channel, especially when we're meeting so many people virtually like this. You can just send them the link to it and to watch. And so when you're implementing this, of course, become familiar with it, with the materials and the app. You can order at counttokicks.org, review any sample course material and make it work for your organization. Make sure everybody knows, again, this is recorded, and so I will be sure to send this out. I'm also going to send out information. We have a continuing education online course where you can receive 1.5 CEs. And again, with our awesome partnership with North Dakota Department of Public Health, we have those available for free for a certain number. And so, and then I'm really big on social systems changes. So integrate into care plans, those touch points, any way you can, make sure you document it. And then a few additional notes. Again, stress the parents to trust their instinct. And I started adding this one because with the role the family plays anymore, you know, especially when we were getting the focus group information back, you know, we were learning that a lot of people were getting their health information from a variety of different sources. It wasn't always their healthcare provider. It might be their mom or their grandma or their friend. And so making sure that anybody that is connected with mom, grandma, grandparents, whatever, understand that this is mom's body. This is mom's, she knows what's going on, so that they don't question her. If she's like, oh, maybe I should call, they should say, yeah, trust your instinct. And so I just want to stress that because of all the generations and living situations and things like that. Share that sleeping lying on their left side is best for them and baby. Totally okay if they wake up on their back, just flip back to their side. Review those common myths that we talked about earlier, and then discuss kind of a plan of action if mom does notice reduced fetal movement, especially I think North Dakota is very similar to Iowa. We have a lot of rural areas that have, 60, 90-minute drives to a facility to deliver baby or to be checked out. And so if she notices reduced fetal movement, make sure she knows where to go, who to call, and what her next steps would be. And then here's just a page. We have a lot of great support, like I said earlier, what providers are saying. This is Dr. Monsager, he's on our medical advisory board, and then Dr. Osborne. And this is a training video. I have a couple slides left. I do really want to share it. So I am going to share it quick. So this is great to share with your team that couldn't be here today or that won't be able to watch this. This is also on our website and YouTube channel.
So here's some information about Count the Kicks. It's a program in the third trimester that helps you keep track of the baby's movements and make sure the baby's moving enough. The little card is a card to download the app. So you can put it on your phone and you can track the baby's movements and make sure that you're getting your kick counts in the day. This pamphlet goes through some information about the program and tells you kind of about the goals. The goal is for
So I just want to be cognizant of your time and make sure I get to the materials. But this training video is about 5 minutes long, so it would be good to share in a staff meeting. But you can see how she's talking to the mom about it and some of the materials of what you could receive. And so when we get to the resources here, what I really want to share is that you can go online. You can it's just counttthekicks.org, click on order materials, then click on North Dakota. And fill your shopping cart. We have them in English and Spanish. We have the brochures, those app reminder cards that woman just highlighted, and then the poster. So the poster you see there on the screen is the how-to poster in Spanish, and then we also have it in English. And so you can see that this is a very bright, colorful, not something you might expect with a stillbirth, prevention campaign. And when I talk about the founders, they really thought about this, and you can tell it's a very Dr. Seuss-like feel. And what they did is when they realized that is they actually contacted Dr. Seuss's widow and said, hey, we're creating a stillbirth prevention campaign. The material looks very similar, the verbiage looks very similar to your husband's. Are you okay with this? And she, of course, said, yes, we have it in writing. I mean, it's just so amazing to think of, all the things that the founders thought about to make this truly impactful and empowering. And I'd be remiss if we did not talk about COVID-19. We have actually created two academies, one for providers and one for parents. And what it is it's truly a suite of things that you can share with your expectant parents. It's a way to navigate when in-person connection isn't happening, and you can send things. It has links, it has PDFs to send. We also have a whole webpage dedicated to COVID-19 and pregnancy. We have some videos speaking to a doctor about COVID-19. And just remember that Count the Kicks is an early warning system. And so here's a little bit more about the provider academies, which again, you can view on our website. And then one of the most important features of our campaign is our wonderful ambassador program. And so we have ambassadors, and you can see everything in yellow is where we have ambassadors. And these are women that they're either, potentially they were lost moms who found us after they lost their baby and they had no idea why and were just Googling, or they are women who saved their baby with Count the Kicks, or they're just passionate. And so what these women can do, they're passionate volunteers. They do it on their own time. They can attend things like medical conferences, baby fairs, do media interviews, things like that. So you can ask them to come present. We are working on a North Dakota one right now, but we will have an ambassador soon, I think, there in North Dakota. There's been just some change. But they're really our boots on the ground in all these different states. Like I said, we're located in Iowa, and so it's really important that they're so impactful in those states. So next steps, again, download the app, play around with it, practice, make sure you share this information with team, order the material. I hope I get all these emails that all of you have ordered materials. Take the online training. I'll update that. That should say North Dakota, but I will send that to you for sure. So you don't have to find it in the PDF link. And then of course we have our awesome baby safe stories. These are also great. We know that the mom to mom and the testimonials really impact our storytelling. And so share these with your expectant parents. We have videos, we have stories. They're just awesome. And then of course, connect with us. We're on Facebook, Instagram, Twitter, sign up for our newsletter. And again, I just can't thank you enough. I can't thank North Dakota Department of Public Health and Mandy, who is my partner in crime over there. That's her contact information. If you have anything specific to North Dakota and you want to contact her, feel free to do so. And with that, I would love to open it up to questions. I went over by 1 minute. I'm sorry, it would have been more. So I can't thank you enough for all your time today. Some of you, I will allow you to talk. If you would like to unmute yourself, you certainly could. I'm going to check the chat really quick. Oh, thanks, Mylin. So Mylin was on for a little bit. And hi, Mylin, how are you?
Great.
Good. Thank you so much for joining us. So I don't know when you joined, Mylin, but I did share a little bit about your story at the very beginning. And so shared about how you really brought us to North Dakota, and we're just so happy to be connected with you and so proud of you and for being so brave to sharing your story. So we appreciate you and thank you for that.
Well, I'm really glad that you were able to do this presentation. It's been probably a year since I've heard it, and I'm really thankful for the people that got on the webinar and listened again, and even just hearing it today, you know, your commitment to health equity is really great, and I'm, you know, grateful to be still a part of this organization.
Yeah, and so one thing I didn't mention that I should have is Mylin is our newest member of our influencer advisory board. And so we have our medical advisory board, which I briefly talked about, and then we have our influence advisory board. And Mylin is just opening doors right and left for us. So it's just awesome to be working with such a powerful woman and advocate, and I just love it. So yeah, if anybody has any questions, I'll stay on for a couple more minutes. Again, you will get a PDF of the slides, you'll get the CE training, order the materials, and we'll go from there. Thank you so much for joining me today. I truly appreciate it.